There was an incident, a man refused his wife going to the hospital, and he said, my mother gave birth to all of us at home, so you too, you must stay back at home and give birth. So these are interactions, discussions that we need to have with the men to understand that seeking health care is very important for these women and their children. They need to understand that this is very, very important, and they need to support that. Because in northern Nigeria, a man can have 4 wives. You can imagine all those 4 wives are pregnant almost at the same time. And then he will tell you he doesn't have the money to take care of their medical bills. All of them should sit down and give birth at home. And the truth is, as the woman, it's better you stand up and empower yourself and look for a way to take care of your health. Why? Because if you die in the process, the man will still go and marry another woman and continue his life. And that is why some of the approaches we are using is donors should focus on empowering women. Women should wake up and start up something to generate income for themselves, to take care of themselves, take care of their health. Because if you sit there and keep on waiting for the men, this statement of my mother gave birth to me at home, he will not bother to even take you to the hospital. There are some men that even when they take their wife to the hospital and they hear that he's CS, they will disappear. You will not see them again. So it's something that is really disturbing. Every day we are having such stories. I met a woman that had about 5 children. Her husband left her with the children. Till date, is 13 years now. She doesn't know where the husband is. So it's better for we women to wake up, know that it is very important for us to access healthcare services. Yes, I know that financially it is not easy, but when you don't just sit down and just wait for the husband to bring in something, when you start up and also support yourself in doing 1 or 2 things, I think it will go a long way. Like one of the things we did for these women was, okay, if your husband gives you money to buy ingredients, we know that you don't squander all. At least you can save 50 naira out of it. In a week, you can get 200 naira and save. One of the women, she started up pepper business, selling pepper, selling spaghetti and all that. So before you know it, when your husband say he doesn't have money for you to take your child to the hospital or to take yourself to the hospital, you'll be able to squeeze out of that business that you are doing to be able to help yourself. So it's really a call for our women to rise up and support themselves and be able to take care of their health. We shouldn't wait for the men to say, okay, you have to give me money to go and register myself for antenatal. Yes, it is on the high side, but since we have accepted to take in that pregnancy and also to keep it, then we should also be responsible to take care of our health and ensure that we also visit the health facility to monitor. There are some women that, yes, they attended antenatal and they give birth at home. It is not bad. It is not a wrong thing for you to give birth at home. But what if there are complications? There are bleeding after you give birth at home. How would that be addressed? And that is why it is advisable for you to either have a healthcare provider or you visit the nearest health facility for you to address these services. This will go a long way in preventing all these maternal and neonatal deaths that we are talking about every now and then. Because if you compare the statistics between the north and the south, everything is about health is usually high in the north, and you keep on wondering, what is the problem? We have the issue of ignorance, we have the issue of religion, we have the issue of poverty, and we just feel, oh, there is no money, I don't have money to go to the facility. You are waiting for everything to be done for you. Yes, everything is done for you by the donor. How do you control your child's birth? Today you go, they give you free health services, and then tomorrow you are pregnant again. Keep on giving birth, increasing the population of the country, and then you don't have the resources to take care of them. So there are so many things, so many factors.
Anyway, that is also another interesting thing. But anyway, we're not going to touch it today because that requires a bit of explanation. You see, it has passed the time that we need to leave everything for the individual people. Because first of all, a lot of a lot of masses are actually very poor in terms of reasoning. They just follow each other. That is why they
Yes.
have a government. Because the government, meaning that all of us have put our power in the head of one person to lead us.
Honestly.
So there is a responsibility there. Where is this country heading? What is the future? What is the plan? What is the project? What are we? You are the leader. What are you leading this country to? You see, these are simple questions that somebody must be able to answer. It's not about looking for who is the oldest president in Nigeria to become the president. It is not about who is the oldest. It's about who can lead this country to the destination. Where are we going? Do we even know where we are going? Because all these things will be reflected on how many children should be given birth to in this country. It's not about this idea that, that God bring children. No, forget it. It is not. Okay, I don't want to say it's not true, but come on. We need to use common sense, no?
Well, you're on the right track of the truth, but that is why I said the way we grew up and the teachings that we got from our parents is what has influenced us so far. So, like you see, when you were talking about and having graduates from the rural communities, and then I remembered somebody that was a graduate and he lives in a rural community. After his service, he came back. He still continued with the normal routine in the community, just to go and farm, carry the goods, go to the market and sell it. You understand? So if there is a way that we can have the youths, trying to have a discussion with them, try to make them see that yes, they have the potential, they have the power to do what they want to do, irrespective of whether the government provide it or they don't. We by ourselves, we can generate resources, we can generate income, we can take care of ourselves, we can build schools, we can employ teachers to come out, even if it is stipend, we can do it by ourselves. When are we going to stop depending or stop blaming the government, and do it by our own selves? We have that capacity, we have that potential. We shouldn't just sit down and be stuck in one place. The truth is that, yes, some people have these religious beliefs about childbirth and all that. But even the holy books, and there are verses in the holy books that religious leaders can use to influence all these things. Sometimes our religious leaders misconstruct all these things and mislead the followers, and then you see the followers saying that yes, it's God that told us to be fruitful, but God did not say we should just go and be giving birth every year now. At least we are supposed to.
Be fruitful and multiply.
That is why he gave us that wisdom for us to be able to, like, okay, at this point you need to do this, at this point you need to do that. So if we can have our religious leaders talk to the men, you understand, have the youths, okay, since our fathers were just giving birth and plenty children, we in our own generation, we are going to limit it to one child or to two child. And that is why in the Western world, they can even decide to marry and say they will not even have a child. And nobody bothers about it. But in Nigeria, you don't have a child in 1 year, 2 years, your mother-in-law is on your head, you must give me a child. So sometimes some of these perceptions, we need to work on how we are going to like address them, because it's true that the population keeps on increasing. You see so many children roaming the streets, nobody to take care of them. Even the government schools that will say, yes, we have government schools, you see the population of children, even the teachers, sometimes they don't even go to teach them. They don't. So those children don't even have quality education. If you want your child to have a quality education, you have to take him to a private school. And how many parents can afford that private school? So the education system is something that needs to be addressed. Also the reproduction, the multiplication of the population and all that. But it all bounces back to the youths, because we are the future of the country. We should stop looking at where our parents stopped, then we should continue from there. No, we should be the ones to change those narratives. What can we do to change the situation of the country? My parents gave birth to 9, 10, 15 children. What can I do to make sure that I give birth to maybe one or two child? give that child the best, the quality education. And by so doing, we are also making the society to be a better place. So I think if we can have programs that can target the youth, trying to influence them, also talk to our religious leaders to see how we can also influence some of these things, I think it will go a long way in addressing all these issues.